Okay, well, welcome everybody. Welcome to our UCI and JCC partnership in health education. And thank you, Pamela, for organizing this program for our JCC. We want to welcome Dean Lazenby and Dr. Sarah Campbell to our talk today. Please put your screen on speaker view and mute yourself until it's time for the questions. You can enter your questions in the chat, and we can also answer them in the gallery at the conclusion of the lecture. I'd like to tell you a little bit about Dean Lazenby. He's a professor of nursing and the dean of Sue and Bill Gross School of Nursing at the University of California, Irvine. He began his lifelong pursuit of positive social transformation in Southern California, working as a community organizer with underserved youth in East LA. He brings with him a belief that the profession of nursing is a powerful driver of social transformation, particularly for health equity and planetary justice. His belief is reflected in his philosophy, and he has several books published on this. The most recent is Practicing the Good Life, the Spiritual Significance of Nursing. Prior to joining UCI, Dean Lazenby was professor of nursing and philosophy and served as the associate dean for faculty and student affairs at the University of Connecticut School of Nursing from 2019 to 2022. And from 2010 to 2019, he was on the Yale School of Nursing faculty. And I will also tell you a little bit about Dr. Sarah Campbell. She's been a registered nurse for over 20 years and spent the first decade of her nursing career in the acute setting. Dr. Campbell attended UC Irvine and graduated from the Master's Family Nurse Practitioner program in 2011 and spent the first 6 years of her career as a family nurse practitioner in an internal medicine practice. Dr. Campbell joined UCI in 2018 and teaches in the Doctor of Nursing program, DNP. She's part of the faculty practice in the Sue and Bill Gross School of Nursing and sees patients on campus at the Student Health Center. Her areas of interest are health promotion, disease prevention, integrative approaches, which is one of my favorites, and chronic disease management, as well as geriatrics. So welcome the both of you, and thank you so much. And we'll start off with Dean Lazenby.
Thank you very much. I'm grateful to be here among you all, and I'm grateful to sit in an office that was once occupied by a fellow member of yours at the JCC, Ellen Olshansky, whose indefatigable pursuits inspire me. I hear she's in rabbinical school right now, so this is just wonderful. That we can be lifelong learners. So I wanted to share briefly a little bit about the school and about what I hope to accomplish in this deanship. And so if we could start sharing the slides. And these have been professionally put together here at UCI. So you can see it's not my handiwork, but this is my title. I believe that we can transform society through nursing. And I want to show you how briefly in this talk. And then I'll turn it over to Dr. Campbell, who will talk about one aspect of this talk, particularly how to live in a pandemic age. First of all, you can see my mugshot by a professional photographer. My wife, Jody Olszewski, she jokes with me that what he couldn't get out with the photoshopping was my bike helmet hair. Yes, I have decided I'm going to ride a bike in Southern California as long as I can get away with it. But I am pleased to be the next dean, the current dean of the Sue and Bill Gross School of Nursing. My journey to the nursing profession, which is the next slide, began here in California. I'm a native. I grew up in Blythe. Anybody know where Blythe is? It's one of the hottest places on planet Earth. You go east on I-10 until you get to the Colorado River, the last town or the first town, depending on your direction in California. I was lucky to leave that little town and go to college and graduate school and become a philosopher. But it was during my time as a philosophy professor that a nurse profoundly changed my and my family's life. I'll tell you about that in a minute. I took some time to decide what to do with my life after that experience and decided to become a nurse. I did that at Yale and stayed on the faculty there after I finished. And I have worked both as a philosopher of nursing. Two books are out. The third that Jerry mentioned on the spiritual significance of nursing is coming out. These complete a trilogy on the ethical, the social, and the spiritual significance of the profession of nursing. I am also an empirical researcher. I study the spiritual well-being of cancer patients, and particularly the effect of a meaning-centered psychotherapy on their spiritual well-being. My personal story into nursing began, the next slide, I think, here we are, when that nurse touched my brother's and sister's life as my mother was dying at Eisenhower Medical Center in Palm Springs. Just one night, she came into the consultation room and held our hand, quite literally, and told us what was going on with my mother and about how we could provide for her a peaceful death. And from that moment on, I knew that I could no longer be a philosopher sitting in an ivory tower. I had to be one who worked with my hands. And so I am a philosopher nurse who works with my hands, both by writing about philosophy of nursing, by teaching nurses, but also by studying the spiritual well-being of cancer patients. So you can see I transitioned into this career, and I believe that as a philosopher nurse, I have a lot to contribute to explore how caring for others can make the world a better place. And that's my theme here of transforming society through nursing. I'm very pleased to be at the Sue and Bill Gross School of Nursing. The next slide, which began now 35 years ago as a graduate nursing program here at the university, but never a school at the time, not a school at the time. In 1995, they began a family nurse practitioner program out of the School of Medicine. But in 2007, they carried on. Ella Noshansky came and helped them move to the program of nursing. But in 2007, that program nursing became, I'm sorry, I should say, let me back up. In 2016, that program in nursing became the Sue and Bill Gross School of Nursing with $40 million gift. And in about 6 or 7 months, we opened the Sue and Bill Gross Nursing and Health Sciences Hall, which you see behind Dr. Campbell there in the picture, and you see on California and Bison Avenue when you drive past it. So the program here at the school offers 4 major degrees. They are the Bachelor of Science in Nursing, the Master's of Science in Nursing for people who have no previous nursing background. Those 2 degrees allow people to become registered nurses. They offer the Doctor of Nursing Practice for people who already have a master's degree, and the Doctor of Nursing Practice for people who don't and wish to become a family nurse practitioner. And then we offer the PhD in nursing for people who wish to go on to become the future nurse scientists. As I take hold of this school and the deanship, I have a vision that the school that the profession of nursing has the power to transform society. And this is the next slide. Thank you. I've written about this in my books, but we are at an auspicious time in society. There is so much going on. We're wondering whether or not for the last 2 years we would survive a lethal pathogen. And now it feels as if we're on the brink of climate change, destruction, and maybe even thermonuclear war, whatever is going on in Europe these days. And I think nursing has something to contribute to all of these aspects of geopolitical realities that we face today in 3 specific ways. The first is through pandemic preparedness. Now, let me just tell you, this pandemic did not start the pandemic age. It began 100 years ago with the 1918 flu pandemic. If you'd like to read a book about this, Nathan Wolfe's The Viral Storm, which came out in 2011, is a wonderful book to read to show you that this is nothing new. SARS-CoV-1 happened in the late 90s, SARS-CoV-2 now. If you read the New York Times, they think that there was a coronavirus that in the 19th century that decimated a lot of Northern European people at the time. So this has been real, and it's been real for people who have had HIV for the last 50 years. So we shouldn't be caught by surprise. What we can do in pandemic preparedness is conduct research. This is the next slide, and educate ourselves and our future nurses and conduct clinical practice that address how we should live and work in this pandemic age. And that's what Dr. Campbell is going to be presenting on after I'm done, how you can live smartly in a pandemic age. But this isn't the only priority I have. Another is health equity. As you know, that the pandemic has shown us that there are health disparities, not just for people of color or for people of low resources, but also for older adults. My wife is a gerontologist. Early on, we knew that this was going to hit vulnerable populations harder, including older adults. And so when I talk about health equity, I include Black, Indigenous, people of color, people with low resources, and older adults. We must focus on transforming these disparate health outcomes into equitable health outcomes. And what we can do is conduct research, the next slide, that tells us how we can give people who've been historically marginalized the opportunity to flourish. Some people, because of their marginalization in society, need more to have the same opportunity to flourish as others. And let's consider older adults. In this, my wife always uses this example in urban settings. Why are the stoplights constructed so that it only takes 15 seconds to get across the street? When you're an older adult, it may take a minute to get across the street. And so as I was riding my bike in today, I noticed at one of the stoplights, it took only 15 seconds. It was only allowed for 15 seconds to cross the street. And a woman who was a little older than me, but slow moving, didn't make it across before the light turned red. These kind of simple examples show us what we need to do in health research, in infrastructure research, to give some people more opportunity to stay well by exercising in the morning, by crossing the street. That's a very simple example of what I mean by giving more people, some people, more opportunity to flourish. It's different for different populations. So for Black, Indigenous, and people of color, we need to go into their communities with healthcare resources, is another example. And I believe at this school, we're already conducting this type of research, and we need to turn it into health policy. And so this is where we're going with research, education, and clinical practice that does this, kind of give vulnerable people more opportunity to flourish. My last priority is climate change. We all feel its effects. I mean, what was it just a few days ago? Almost 90 degrees. It was uncanny, even for these parts. We can't tackle climate change as a nursing school. It's too big a topic. We have people here at the university who do the big climate research, but what we can tackle at the nursing school, on my next slide, is we can focus on what we need to do to create climate resilient and sustainable health systems. In the last climate change conference called COP26 last November, 50 countries agreed to develop climate resilient health and sustainable health systems. What are we going to do here at home? How can we in our nursing education use less plastic tubing, use fewer disposable resources, and look for renewable resources in how we teach? How can we in the hospital do the same? There are studies already afoot on this, and I wish us to think about it here at UCI. Why do these three areas matter? If we go to the next slide, if we can address climate change, Western Europe is not so dependent on natural gas that comes from Russia. And that is a part of the big geopolitical struggle right now that's going on. If we can address health equity, we have then less poverty, fewer healthcare resources spent on people needing really intensive care at the end of life, and they're well longer into their old age. And if we can address pandemic preparedness, we will no longer be caught by the next novel pathogen that comes around. And there will be another one, because they've been around for at least the last 100 years. They're not going away. So if we can do this, we can transform society and live better lives ourselves. And that's my ultimate goal here at the Sue and Bill Gross School of Nursing. And finally, before I turn it over to Dr. Campbell, let me make an invitation here and invite you to think of how you can be a part of this transformation of society. Juliana Goswick, who is on the call, and you can see her Hollywood Square somewhere here. She's waving her hand. If you would like to be involved by donating or giving to scholarships or supporting endowed chairs or just volunteering your time, please reach out to her. And without any further ado, I want to give you over to Dr. Campbell, who's an expert in aging and is going to talk with you about how to age well in a pandemic age. Without further ado, Dr. Campbell.
Thank you. Thank you so much for allowing me to speak today as well. And I'll go ahead and share my screen here and get started. I wanted to talk today a little bit about not only recovery, but also resilience, because I think resilience is very important to talk about today. But I first wanted to share a little bit about my story. So next slide. I wanted to explain how one gets from becoming a student, a nurse, to a student at UCI to a faculty at UCI. So I'll talk to you a little bit about how just my journey itself. Like I said, I've been a nurse for about 21 years, and I landed at St. Joseph Hospital here in Orange County as a new graduate nurse on a very heavy floor. It was cardiac floor, diabetes, kidney disease, hemodialysis patients. And what I found was a lot of those patients were being readmitted over and over again. I was seeing the same patients over and over. And I thought, how can we help these patients while they're here in our care to get better education and not and understand their processes better and kind of what's going on with their heart and their kidneys and their diabetes, so they don't, come back so often. So I really got passionate about patient education, and I started a team for heart failure education and led that team in the hospital. And from there, I went to an outpatient heart center at St. Joe's and became the heart failure coordinator. There I partnered with our cardiologists in helping to teach our patients about high blood pressure and how to eat healthy and how to stay out of the hospital, really, because that's the goal, to stay home, stay out of the hospital, not go back. And so in that role, I was really finding that my role as a registered nurse was quite limited. I wasn't able to really order labs. I couldn't change prescriptions. I always had to call the doctor. And so they encouraged me. The cardiologist said, you need to go back and become a nurse practitioner. You really need more autonomy in this role. And I thought, yeah, you're right. At that time, I started looking for programs, and UCI was just at the forefront of starting their own master's program. They had been partnering, through School of Medicine medicine, they had their certification program, and they'd partnered with Cal State Fullerton, but they were developing their own program. And that was when Ellen Oshansky was the dean. So she was the dean of this new program, and it was their own master's program. And I thought, there's no way I'm going to get into this school. This is like a top school for medicine. There's just no way. And I can't afford this school. And they were only taking like 10 people in this, they thought, let's keep this cohort small. So I thought, there's just no way. And I prayed and prayed and applied for every scholarship. And lo and behold, I got in, and I couldn't believe it. But I couldn't get in without the scholarships that I got. But I got in and made it through the program. And I had a baby in the program. I was hospitalized for asthma during the program. But I got through because of the faculty and because this program was like a family to me, really. And right out of school, I got hired by the physician that precepted me in his internal medicine practice. So that really tells you the kind of program this is. I had a lot of support. And, as I was, in my internal medicine practice here in Irvine, one of my faculty came to be my patient. And if you think that's intimidating, having one of your faculty members become your patient, and she brought her whole family, it was quite intimidating. But it was a compliment. And about 5 years into my practice, as I was precepting students from UC Irvine and training our NP students from UC Irvine, she said, when are you going to come teach? And I thought, well, I don't know. I just hadn't really thought about it. She said, you really should come back and teach. Our students love when you precept them. And so I came back and got invited to teach, and I absolutely loved it. I was mentored by our faculty here, and so I wanted to come back and give back because I really thought that was important, because we're seeing that there's a big shortage in good primary care providers these days. Physicians are going into specialty areas, and we're not seeing a lot of providers going into primary care, especially gerontology. And that's a real big gap, and nurse practitioners can really fill that gap. And so I got invited to teach, but the reason I came back to UCI is because UC Irvine is the only UC in California that actually has a faculty practice. And I didn't want to leave my practice and stop seeing patients. And we have our nurse practitioners here on faculty actually still see patients. And I think that's what makes us really good, is that we're not only teaching, but we're still in practice seeing patients every week. And that's why, we have credibility and we're still relevant, in practice. Next slide. I want to talk a little bit about COVID, because COVID has been a challenge for all of us. And during COVID, we had the task of transitioning our previous master's program from a brick and mortar in-person program at a master's level to an online doctorate level program. And we had to figure out, how do we do this? How do we teach nurse practitioners to assess online in a virtual setting? We were doing this all the while erecting. We were the first ones. Our faculty practice was charged with putting tents up to do COVID testing. So UC Irvine was the first tents. We were some of the first tents in Orange County to do COVID testing. And you'll see in this picture here on the left, that's me doing the COVID testing on campus here. And this is March. I mean, we erected this tent early, and Dr. Suzanne Phillips was the one that really kind of manned all the tests, the testing sites, and got us up and running. And our faculty practice really ran the sites. And I was coming home every week not knowing if I was going to expose my family. I mean, we were on the front lines. And then I had to learn how to teach kindergarten and fifth grade, which I don't know how to teach. That summer, I got a call from my dad saying that my mom had been found on the floor, unconscious, and he had to do CPR. And she was admitted to ICU, and they were telling me that she was not responsive, and they didn't think she would live, and that we would probably be faced with having to pull her off life support. And at that point, I realized what all of my patients were going through, because I couldn't see her in ICU, and they had to do FaceTime with her on the ventilator. And at that point, I realized, this is what this is feeling like. This is what my patients are going through. So as I'm calling patients with positive results, and they're telling me, my wife was just admitted, my mother was just admitted, now I was on the other side experiencing that feeling of helplessness when I'm trying to call in and get information about what's going on with a loved one. And it was a real lived experience. The miracle is she had a full recovery. She lived I mean, it was a true miracle. They couldn't believe. In fact, people who had been taking care of her in ICU had to come see it for themselves because they couldn't believe that she was up and walking and talking and making a full recovery. That fall, when I was teaching, I was implementing my own doctorate project. So while I was teaching full time, I was in a doctorate program, and I was implementing my own doctorate project while I was teaching health assessment online, and my father had a stroke. 7 weeks later, the mom who had just lived through this miracle in the summer had a stroke. So I had two parents who had a stroke 7 weeks apart, and then 3 weeks after that, our whole family got COVID. And so while I'm telling you this only because I felt it, I mean, we lived through, and it was like wave after wave after wave, and I'm sure as many of you felt, it just was like, when will the tsunami end? You know, the waves kept coming. And I remember even just talking to patients going, you know, what next? What next? How much more can come? But you look back and go, how did we do that? In May, I have a picture here, I graduated. I did it somehow, we got through it. I ended up learning how to teach 5th grade math. It's this new way of math, and we did it. And that was because I have a team of faculty around me. My students are amazing. They supported me just like I supported them. Next slide, please. I want to talk a little bit about what older adults have faced over the last couple of years, because I think it's important really to kind of look back at what we've come through and what the challenges we've faced. And many of that has to do with, you know, we knew that we would have some isolation, but I think at first it was like weeks, and then it was months, and now it's kind of been years. And I think we took for granted how much of a toll that would take, not just on mental health, but also on physical health, and the barriers that we didn't foresee. Just the logistics, if you hadn't ever ordered groceries online and you didn't know how to do that, all of a sudden you were forced to do that. If you weren't doing mail-in pharmacy prescriptions and you hadn't had that set up, now you had to do that. So there was this shock of, I don't know how to do that, I have to do that. And just that sudden being told by agencies, well, the caregivers aren't coming out. Well, then what do I do? What does my father do? How do I get people to my father's house? How do I care for these people? I would get calls with people who I was telling, hey, your results are positive, and they would let me know, well, I'm caring for my mother who's a dependent. If I'm positive and you're telling me to stay locked in a room, how do I provide care for my mother who's a dependent? We were faced as you know, providers with questions we'd never been faced with, and so we had to find answers and kind of rely on each other to help really support our patients. You know, things that we took for granted, that we just, you know, didn't know how to do. Next slide, please. Other things really were the barriers to care. So having shut down some of these, you know, medical offices saying we're not you know, limiting visits, but you can't come at all. Only hospitals were open for a period of time. And I think one of the things is that, you know, we were all forced to do this telehealth thing, right? What is telehealth? What's Zoom? What's DoxyMe? How do you do this? How do we open it? And I think it forced us to, you know, the learning curve wasn't just steep, it was 90 degrees. And it, you know, I think the highlight of this that I like to look back on with joy is the fact that we now have an opportunity to look at it and go, we've come out the other side, and while there still are challenges, we now have an opportunity to meet patients in their homes and reach many more patients than we were able to before. And while there are still challenges, now patients who don't have access have access. Now patients who can't get out of the home can actually be seen by a provider and have a visit and not have to leave their home. We can meet them where they're at and see patients more frequently in a virtual visit. So I think, you know, these are some of the positive things that the pandemic has somewhat, you know, forced us to do. When we look, next slide. So let's talk a little bit about some of the challenges we've faced, that we were forced to face is not just the loss of loved ones, but just the loss of independence and that restriction. And it forced us to really kind of go, the freedoms that I had, and even some of those milestones that I missed. And so we also noticed that chronic illnesses or things that we were managing well kind of got lost in the shuffle. The priorities had to change. And so I want to talk a little bit about how do we recover, and now how do we really start to heal, right? How do we now come out of this, and what do we focus on? What becomes the priority? Next slide. So first we want to acknowledge kind of what we've been through. I think one of the things that we tend to do is forget that we've been through a trauma, a collective trauma, and so we want to give voice to our experiences and really talk about, are we okay? Are you okay? And ask that question. Am I okay? Are you okay? Notice one another, notice what we're going through. And if you're not okay, talk to a trusted friend, but talk to your healthcare provider. It's okay to say, I'm not okay. I'm kind of snappy. I don't know if my coping mechanisms are working or if I have the healthiest mechanisms. I'm kind of snappy. I'm kind of angry, or I'm doing things that I probably shouldn't be doing, and vocalize and verbalize that, and then explore our strengths. What are the things that you have that are gifts that you have? What are the things that you look back on and go, I kind of did pretty well at that. I did okay. These are the things I did well. And where are your strengths? What are those things that you do well that you want to continue to nurture? Rather than focusing on the things that we didn't do well, what did we do well? And how can we continue to nurture that and do more of that? And when we find those strengths, how can we rediscover our purpose in life? We're all created uniquely, and there have been studies done, one done at UC San Diego, that shows that people who have a purpose, when they find their purpose, they actually have better physical health and live longer. So people with purpose live longer than those without purpose. So rediscover your purpose. If you haven't spent time intentionally kind of thinking about what you were created to do or what your unique purpose is, think about that. So spend some time really kind of rediscovering your own purpose, and are the things you're doing in your life or saying yes to aligning with that purpose? And then using your gifts and your purpose to serve others. So once we kind of remember, what am I good at? What have I been doing well? And how do I give that away? How do I use what I have? And even if it's not much, what can I give? What can I give to others? Because when we give to others, we focus on the joy of giving rather than the weaknesses and what's going on around us. Next slide. The next thing we need to do is focus on reclaiming wellness. And we often can identify physical and mental wellness even, but there are many aspects of wellness. And so this wellness wheel is kind of what I teach my patients about. There are many aspects of wellness. So next slide, we'll talk about some of the main ones here. So spiritual wellness. So really with intentionality, how are you cultivating your own spiritual wellness? And it's just kind of like when I talk to my patients about exercising and spiritual wellness and eating healthy doesn't happen by accident. We have to really carve out time to cultivate spiritual wellness. So are you carving out time daily to spend time spiritually, connecting with God, connecting with your soul, connecting with others? And that goes along with social wellness, right? We do still have some limitations, but when you're with someone, are you making a connection? When you are with someone, are you looking in their eyes? Are you putting the phone down? Are you spending time watching TV side by side, or are you looking at each other, right? Are we writing letters or cards? Are we picking up the phone? Are we reaching out when we can and how we can? Social connectedness, loneliness actually is one of the biggest predictors, you'll be surprised, of cardiovascular health. So people who are lonely or are isolated actually have a higher chance of having cardiovascular disease than those who are staying socially connected. So it's really important. It's also important, it's also a risk factor for Alzheimer's disease. So really staying socially and emotionally connected to others is very important. Environmental. So if you have a choice whether or not to go outside, if you have a safe space to go outside, get outside and get some fresh air. If you can play cards on your patio outside in the shade, do it there instead of inside. If you can get outside and garden, get outside and get your hands in the dirt, get some fresh air. Sometimes what I like to do with my kids, even if we can't, go out and play with others, during the pandemic we would do this. We'd go outside and I'd say, okay, what can you see? What can you smell? What can you hear? And what can you taste, if anything? So we would just engage our senses. Sometimes we'd go on walks as a family and do that, just to try and engage the senses. If you have a pet, getting that time with your pet, right? And then look at your environment in the home. Is your environment safe? Are you making sure that the environment around you isn't going to lead you to accident or injury? And staying mobile is really important for that reason, right? Staying mobile and making sure that you're not at risk for falls, that you're getting the movement in that you need to, even if you can't get out of the house, that you're moving within the home. So doing what you can. Next slide. And then throughout the pandemic, many of us may have identified areas where financially we weren't prepared, or some things took us by surprise. So address those things. If you realize that there were some documents or paperwork or some areas where financially you weren't healthy, or that you need to address, take the time now with intentionality and address those things. Whether or not it's keeping documents in a weatherproof safe. We had some fires in 2020 that evacuated big parts of Orange County. Are your documents safe? Do you have some things you need to get ready in the next year or for the next 5 years, planning ahead? Do you have a durable power of attorney? Do you have an advanced healthcare directive? If you don't, do you have a plan to get some of those things in place? Given that we've been going through a pandemic, are we preparing some of the things that we need to? And did the pandemic make us aware of some of those financial aspects that we need to tend to? And then same with intellectual. Engaging your mind every day is so important for mental well-being and staying alert and connected, being mindful. So whether it's playing games, whether it's connecting socially, whether it's reading, journaling, some of these are good things to do. Next slide. So just want to wrap up. So just to recap, our nurse practitioner program has transitioned now to a doctorate level program. One of the reasons for this is that we are really trying to raise up nurse practitioners that have a level of training that engages them in the ability to lead in health systems, in be leaders for change in evidence-based practice, and take what our researchers are doing and translate it into the healthcare practice today, to go into rural areas and develop practices now that we've passed and we have full practice authority in California, to really go into rural areas where there are no providers or where there's a lack of providers, and be there to serve underserved populations. We have a shortage of primary care providers, like I said. Nurse practitioners can fill that gap. And so at UCI, we have a legacy of, we are the only school in the nation that has a 100% pass rate on our national certification exam. Nobody can hold that title. We have that title so far. And so this is a strong program, and we are really trying to raise up leaders that can, care for our community, care for underserved populations. Older adults are one of those. I'm very passionate about teaching our students not to ask what's the matter, but what matters most to you as a patient. What matters most to you? And if you find right now that you're not getting that, ask, and speak up for yourself. Tell your health care provider, I'm feeling dizzy, I'm feeling unsteady, I want to address this, I'm not okay, I'm feeling hopeless, I have a sense of hopelessness, or I'm grieving and I haven't gotten over it. Speak up and advocate for yourself, because what matters most to you matters most to me. Thank you so much for letting us speak today. Oh, Jerry, you're on mute.
Are there any questions that you'd like to ask? You could just unmute yourself or wave, and we will unmute you. I'm actually very impressed with your philosophy, Dean Lazenby, and what you had said, Dr. Campbell, about the advancement of the nursing program. and all that they can do and in filling a tremendous need. So thank you both for all of that.
You're welcome. Philosophers never think small, right?
But it shows leadership into the future and to make things better. So we don't have any questions?
Jerry, I do.
Go for it, Ron.
And first of all, I want to comment about the nursing program. I am so proud. I have a granddaughter who's graduating from nursing school at Seattle University. But my question is, can you tell me more about, or all of us, about the $90 billion hospital that UCI is in the process of building, and approximately how long might this take?
I will give you my best stab, Ron, but with a caveat that I've been here 6 weeks and 2 days, so I'm not the most in the know. Others on the call may be more in the know. It was built to bring UCI Health more closer to South County, and it will be a locus of some specialties, including oncology and I think older adult care, among other specialties. So it is a way for UCI to bring to Irvine and Newport Beach and South County some of the expertise that UCI is really known for, which includes cancer care and geriatrics. They are two of the strongest departments at UCI Health. So that is why it's being built. Its timeline, I think, is still a few years off. Is that right? You in advancement would know more about that than I do.
Yeah, so there's 3 phases of the buildings that are going up. So the first building is a Center for Advanced Care, and that is slated for early 2023. And then I believe the Chow Comprehensive Cancer Center is slated for 2024. And then the actual hospital with the new emergency department will be open in 2025. So not too far out. I mean, you can already see the construction. It's really amazing.
We had a speaker talk about the whole program, and I forgot his name. Pam, do you recall?
Yeah, it was Chad Lefteris. So that's the CEO of the hospital. And we can always welcome him back, Jerry, to give some updates if you'd like.
Yeah, that would be great. And if you want to get the whole picture, we did record that, and it's on demand at the JCC programs that are recorded. So you can always check it out. It was very impressive, and I'm very excited because as this community is aging, we need state-of-the-art healthcare, and so.
But let me say, Ron, that I'm excited that your granddaughter's becoming a nurse. This is wonderful, and I hope she sees the power of the profession to touch people's lives. I hope all of you have been touched by a nurse at one time, and that you remember as a positive experience. There is a societal image of nursing as Nurse Ratched. We can pull that image out really quickly, right? But I want to propose for you, for every one Nurse Ratched, there are 10 Ron's granddaughters out there who have gone into nursing because they want a good job, but they also want to help people, right? And that's who we are. We want to help people, and we want to help society. And so I'm just excited that your granddaughter is going into this profession.
Well, thank you. And she just loves what she's been doing, what she's been trained to do. She is so excited about it.
That's great.
That's terrific.
Any other questions? Any other thoughts you want to share before we say goodbye for today?
I have a quick question for our dean. And, I often forget the actual numbers, but I know we are, in a nursing shortage now. And I didn't know with the pandemic if those numbers have changed. And I know Ron's granddaughter, right, is going into nursing. And I think Dorothy Lazinski and I have had conversations about a family member as well for her. And good to see you, Dorothy. But I'm wondering if our dean can give us kind of a glimpse of what the shortage of nursing is going to look like in the future and how we can address it.
Yeah, the profession of nursing is being hit by what many of the health professions is being hit, but the workforce around the country, and it's called the Great Retirement. So nurses who are in their late 50s and early 60s are looking toward retiring, and that is, some estimate, upwards of half of the nursing workforce in this country, which is close to 3.5, 4 million nurses. Let me put that in perspective for you. When you look at the Bureau of Labor Statistics, their roles for the most populous profession in the country, it's retail, right? And that makes sense. But when you look at their roles of the profession that you need a qualification for, so a degree of some sort and certification and licensure, nursing is the most populous profession. So the country's largest qualified profession is facing the Great Retirement. And so we do need nurses like Ron's granddaughter to come into the profession. We don't know exactly how many of these nurses are going to retire. That number's not been, there have been polls around that. In part for legal reasons, we can't ask those questions, right? Are you thinking of retiring? But we know just by age alone, this is going to happen. And COVID has sped it up because some people have decided that they would rather spend time with their family over the next 5 years rather than work till 68 or 70. So it is estimated that over the next 10 years, we'll need more than 1 million nurses in this country. What's more profound for me is that around the world, there are over 22 million registered nurses. We are, around the world, the largest profession, not just the largest healthcare profession, but the largest qualified profession around the world. And the same effect is happening. You can imagine in China, with the aging population there, they are facing a severe nursing shortage. I've had postdocs from China, and they're really going back trying to educate the next generation of nurses because they see the same effect happening. So if you want nurses to be not just the most trusted of all professions, which we have been for 20 years straight, but also to care for you and to care for in making the world a better place, encourage your grandchildren and great-grandchildren to go into this great profession.
And we're so lucky to have such a wonderful program at UCI for them to get the education. So.
Yes, indeed. And we are a small program, Jerry, and that's mandated by the Board of Registered Nurses of California. But what we intend to do here at UCI Sue and Bill Gross School of Nursing is educate the next leaders of the profession of nursing. And we really are taking it seriously that we're a University of California and we can educate that next swath of leaders to advance the nursing in the state and in the country.
Are you the only nursing program in the UC system?
No, that's a good question. There are 4 nursing programs in the UC system: University of California, San Francisco, University of California, Davis, UCLA, and UC Irvine. But only UCLA and UCI have a bachelor's program in nursing. So we are only 2 out of 10 campuses that have bachelor's programs in nursing. And let me tell you, We get the creme de la creme. We are the most competitive bachelor's program for admissions in all of the University of California, all 10 campuses. So the students who come here are as smart, if not smarter, than the students I used to teach at Yale. They are really the best and the brightest.